through your bloodstream and your lymphatic system. And we have our brain connected here in our body, in our head, linked to Alzheimer and a lot of degenerative diseases and chronic inflammatory diseases. We have to wonder why these feelings, excuse my Spanish, have such an impact in our system. Mercury is toxic, and we have to stop guessing that the government think that what we have in our mouth or what the cheapest filling is appropriate for our body is not the right thing. There's studies done. I'm a member of the International Academy of Oral Medicine and Toxicology. We're a group of doctors really truly dedicated for the care of our patients. A lot of science behind that. And we try to educate on a daily basis our patients. They come in, they think they're silver, and the content of an alloy is determined, the name and is determined by the greatest element part of it, and mercury accounts for 50 to 55% of the content of these silver fillings. So I just want to create a little bit of awareness of that, because for me as a caring doctor, I want to put in my patient's mouth whatever will create the least amount of inflammatory proteins, the least amount of toxins circulating through their body, and having a major impact on the brain, on the long-term healing and regenerative factor of their cells. So this is one of my passion, and I spend a lot of time trying to educate my patients about it, and I'm very open if you guys have any questions about it, just bring it on.
That's awesome. Very nice.
I just wanted to say that I am truly privileged to work with a group of healthcare professionals like these here that care, you know, because I hear every day that, oh, doctors don't care and, you know, they just want to prescribe medicine. Like, I hear from a lot of people that's the perception. But we're here tonight to show people that there is a group of healthcare professionals that cares, that wants to address the root cause of disease and not just put a Band-Aid on it. Okay, so we need to grow this group of this community, the group of healthcare professionals that take this same approach. Okay, and our goal here is in having these weekly healthy happy hours is to invite more healthcare professionals and non-professionals as well, because most people know a professional, to these types of events, and to gather people with like thinking. Okay, and we're looking for a revolution, correct? We're really optimistic in our desire to change the world, one person at a time. That's where it starts. Okay, so we're like a small group of health warriors out there, and you know, it starts with taking in information, educating ourselves on the types of information that was presented tonight, and then also sharing that with someone else. So what I would ask is, if you learned something tonight, even if it's just one thing, you know, maybe it's something about blueberries or tart cherries, or, you know, lowering, you know, meat consumption, whatever it is that you took away, share that with someone, and that's how this thing is going to grow. Now, many of us are here because either we're maybe looking for an answer or a solution, or we know people that are, or we're looking to maybe help other people get on that path. And we have the answer for you, and some of you have actually tried it tonight. It starts with superfood, super nutrient dense food, as we all know. We have found a manufacturer of these foods that actually cares, just like these doctors and these healthcare professionals that we've had tonight. Just like they care, we have found a food company that has aligned themselves with the principles that we believe in. Okay, and we mentioned tonight about the food companies. You know, they're a big part of this, okay, because the product that they're putting out, in many cases, I hate to say, is hurting people. And so we found a great company called Purium Health Products, and what they have put together is a 10-day program to help people get on the path, because everyone needs a start. You know, that's what most people, if they want to do better, they struggle a little bit with how to do that. Where do they go? Like if they go into the health food store, they go into Whole Foods, like where do I even start? They don't even know how to walk the grocery store, right? So we find that people benefit from an actual system. And that's part of what Drs. Popkin and Kammerman actually teach professionals through their iMedical consulting practice. They teach them a system, and that includes Purium Health products. So where it starts is with a 10-day transformation. It starts with taking a 10-day vacation from the food that people are used to consuming. It's like a complete reset. It's a metabolic reset. It's a detox. It's breaking cravings and addictions to food that people just can't stop consuming, even if they want to. So what is this 10-day program all about? Well, I'm not going to tell you. I'm going to show you. This little 6-minute video is going to show you exactly what it is included, and then we'll talk about the next steps. So, Jay?